Senator Warren.
Thank you, Mr. Chairman. Community health centers provide essential services to our communities, but they need federal funding to do their work, and they need that funding to be predictable and sustainable. So exactly 1 year ago right now, community health centers across the country were running out of funding because Congress failed to reauthorize critical programs before they expired. Some of you may remember that. For 4 uncertain months, until Congress finally acted in February of 2018, health centers and their patients were in limbo. They held back on hiring new people, on replacement staff. They deferred opportunities to make vital improvements in their programs. And while most funding directed to health centers was still flowing during the government shutdown that ended last week, other vital funding sources that patients rely on were cut off. The next primary care cliff is only 8 months away. So today I wanted to dig into the impact of unpredictable funding streams on the patients who are served by health centers. Mr. Trumpeter, your health center has several sites in Washington state. Do many of your patients rely on federal food and nutrition programs like SNAP and WIC or federal housing vouchers, all programs that were affected by the recent government shutdown?
They do.
And how did your patients deal with the uncertainty caused by the 35-day shutdown?
Senator, we've seen an increase in anxiety amongst our patients. Most of this is pretty anecdotal at this juncture, but we've queried our front desk, who are usually the folks who get told this stuff first. And we do know that a lot of our patients, particularly those that rely on benefits like SNAP and WIC, have been worried about whether or not they were going to have the nutrition that they needed in order to follow the advice of their doctors. I am also aware of 2 patients, and this is small-scale stuff, but who made what we might consider short-term smart financial decisions, maybe not so much in the long term. One of our patients just decided that he was going to stop paying his bills for a while. And if you don't pay your rent, sometimes you don't have a house. Another patient decided that he would just use his credit card in the meantime. And we try to counsel these folks, but in the face of the kind of uncertainty that they were facing, it's really kind of futile.
Yeah, I understand. These are people who don't have a lot of financial alternatives. Now, health centers also saw other impacts. In Massachusetts on Cape Cod, one health center wasn't able to pay the bills on a critical facility replacement projects because they were no longer receiving funding allotted for the projects from the U.S. Department of Agriculture. The shutdown also had indirect effects on health centers in the D.C. area. Dr. Anderson, many of your patients' livelihood depends on the federal government functioning, with some family members of your staff as federal employees. What impact did the shutdown have on your patients and staff?
Thank you, Senator Warren. I can definitely say that anecdotally, the shutdown did have an effect on both staff and patients. Many staff members are married to federal workers, rely on that 2-income household to live in the Washington, D.C. area and pay their bills. But I would say also for our patients, many of them rely on the foot traffic generated by the federal workers. So, for example, I might not be seeing the actual federal worker, but I'm seeing the person they buy coffee from, I'm seeing the person they stop and get a hot dog from on the way in, or the person that maybe there's a shoe shine guy, or there's the person that delivers food to the corporate boardroom meeting. You know, those are the unseen patients that we see and we give dignity to at the health center level. And for so many of Americans, as we all know, live from paycheck to paycheck and don't have an emergency plan. So there was definitely a huge impact and a lot of anxiety in our patients when that type of supplemental income was not guaranteed.
So thank you, Dr. Anderson. I appreciate that, and I'm sure everyone has stories around this. You know, while President Trump demanded a border wall and Republicans let him hold our government hostage, American families were struggling to make ends meet. I am glad that the government is open again, but we cannot do this again in 2.5 weeks when the next deadline comes. And whether it's due to a shutdown or because federal programs aren't reauthorized until months after funding expires, we can't keep putting our community health centers and their patients in these uncertain and unsustainable positions. I am glad that Chairman Alexander and Ranking Member Murray have proposed a 5-year extension of primary care programs so that health centers have more certainty and predictability. Patients are depending on us to make sure that they have consistent access to care. Thank you, Mr. Chairman.